Good evening. I am Kayla, and I will be talking to you today about trauma-informed care and how to incorporate it into our schools. I'm also going to talk a little bit about what it is, why it matters, and how we can implement it to create a safer and a more inclusive learning environment for our students. In 2023, the CDC reported that 75% of students scored at least a 1 on the Adverse Childhood Experiences scale. That's 3 out of 4 children that are carrying around trauma into our classrooms. Trauma doesn't just affect their emotional stability, it also affects their cognitive abilities, their memory, and emotional regulation. If we were to ignore trauma, we risk misinterpreting behaviors and missing opportunities that are critical for healing. It's important to realize that trauma-informed care isn't just a strategy, it's an entire mindset. There are core principles, 6 to be exact, that safety, as well as cultural humility in terms of understanding gender issues, cultural issues, and historical events and how it has impacted the students. There's also empowerment in teaching them how to use their voice and also letting them know that they are capable of making choices. There's also collaboration and peer support and trustworthiness and transparency. There are also 4 key elements: realizing the impact of trauma, recognizing the signs and symptoms of trauma, responding to integrated knowledge about trauma, policies, procedures, and practices, and resisting re-traumatization. It's important to also utilize staff training in order for this to be effective. Staff training and support is one of the key elements for the students to have a positive school year, as well as to have happy staff. To implement trauma-informed care, staff must be equipped with several things, one of which is learning to identify the signs of trauma. Some students don't say that they've been through trauma or something traumatic. They may not even view it as traumatic, but their response to us, their body language, and their behavior tells a larger story. It's also important to understand and reduce secondary trauma. We tend to absorb what we hear from others and what they're feeling, and this is something to take into consideration when you're using trauma-informed care in schools. It's important to reflect on personal trauma and its impact on us, as this impacts how we respond to our students. And lastly, using supervision. This is not just for us to take accountability for our actions, but also for emotional check-ins. Because if you're not okay, your students aren't okay. This isn't just professional development. This is personal development. Trauma-informed classrooms can be a healing space, but that can't happen unless we are creating routines that are predictable. By doing that, we're reducing anxiety. It's also allowing us to use strength-based communication skills. It's also fostering relationships between us and the students, as well as the students and their peers. This can be done during group work or circle time. It's also the impact of lighting, sounds, seating arrangements, visual presentations. All of these things are a part of trauma-informed classrooms. Dimming the lights a little bit having that predictable routine or having some type of visual as to what is happening throughout the day. They may seem small, they may seem silly, but they make a big difference. Trauma-informed behavior focuses on positive reinforcements, not negative consequences. It also focuses on teaching emotional regulation and problem solving, not isolation. And it creates a nice breeding ground for trauma-informed counseling and social emotional learning. These are things that most children aren't learning. It may be because their environments aren't allowing a space for them to learn this, or because the people in their lives don't know how to implement this. But as educators, it is our job to teach. So why not teach them everything? Not just their ABCs, but also how to become one with their emotions, how to express themselves, and how to properly communicate. As stated, simple things that we're not thinking of make a big difference, such as calm lighting, setting clear expectations, as well as a clear routine of what is happening, visuals about what's going to happen throughout the day. It also creates a space where children feel seen, heard, safe, and supported. That's part of social emotional learning, hearing them, reflecting on what they're telling us. And in order to hear them, we must understand them. And we can't understand them without understanding where they come from. That's why it's critical to have families involved as well as their communities. It takes a village. It's important to understand what village we're dealing with. Trauma-informed care extends beyond the classroom. It's partnering with families. It's understanding their language. It's understanding their perspectives, their values, and as well as building community trust. It's letting the community know that just because you may have graduated or maybe you didn't attend school at all in our community, it doesn't mean that you still aren't a part of our community, and it doesn't mean that you aren't important, especially when they play a big role in the lives of the students that we teach because they see them half the day and every weekend. Healing is a collective factor. It is not individualized. It takes a village. So what is the impact of trauma-informed care? When it's incorporated in schools, there's a large impact. When schools embrace trauma-informed care, they're also embracing lower dropout rates, fewer suspensions and detentions, less pinned petitions. They're also promoting more inclusive education, learning about their students, their cultures, and their teaching styles. It's also showing better support for educators. It's also adding a healthier classroom climate. This isn't just a theory. This is an entire transformation. But the motivating factor behind it is still educating our children. And it is still the reason why we do what we do. So in closing, trauma-informed care isn't a trend. It isn't some very famous TikTok trend happening. It is not some flashy dance that the kids are learning. It's not some weird saying that most of us in the classrooms are probably banning from being said in our classrooms. But it is very important. It's a necessity. It's critical for learning. It fosters inclusion. It embraces students to be empowered, and not just the students, but also teachers, staff, everyone in the school system. It's a commitment for sure. and it's going to be hard. But when we're doing this, we are creating schools where every child feels safe and valued. They feel listened to. And when they're able to feel safe and valued and listened to, that means that they're ready to learn.